Today we're going to talk about medication safety. Taking medication exactly as ordered is of paramount importance, considering 82% of adults take at least one type of medicine. 29% of adults take 5 or more medications according to the Centers for Disease Control. Medication errors account for more than 700,000 emergency visits and 120,000 hospitalizations every year. Those are some really significant statistics. When there is an unplanned or unwanted reaction to a medicine, we call it an adverse drug reaction. Fortunately, many adverse drug reactions are preventable. Medication issues are a primary source of worry for caregivers. Trips to the ER and potential hospitalization are usually emergencies, taking caregivers away from younger family and work responsibilities. The everyday obligation of ensuring elders take medication safely is a big responsibility for caregivers and can often include daily phone calls and visits. Oftentimes, caregivers experience helplessness, anxiety, and even loss of income due to time away with the senior or for emergencies. It's not always easy taking medications on a schedule. Dosing several times a day and making sure medications are renewed on time is difficult. Seniors, even those without memory impairment, experience their own set of challenges properly managing their medications. Feelings of fear, confusion, and anxiety that they're placing stress on their family can be very upsetting, especially with a new set of health complications brought on by adverse drug reactions. So let's talk about how to prevent medication errors. Keep an active and accurate list of medication. Review each time you see a healthcare provider. Make sure to use a device like a medication box. I have one here that I really like. It's got 4 segments, so you can take pills 4 times daily with meals, for example, or if you need to take a medication at bedtime. It also provides a check and balance system. When you're using a box, you can go back to the section if you are having any confusion about whether or not, for example, you took your medications with dinner. There's also a really great device called the Pill Pouch, developed by a fellow entrepreneur here in Michigan, which is a really great way to organize your medications. There are examples of what each medication looks like with the name, the dose, and the diagnosis that it's being prescribed for. Really helpful. You pull this out when you're filling your medication box every week. You can also use an electronic reminder device to ensure accurate dosing and scheduling of medicine. Another way to prevent errors is taking medications exactly as a physician ordered. For example, take antibiotics with milk, or your thyroid medication on an empty stomach, or no grapefruit juice if you take cholesterol-lowering medication. Make sure every caregiver has a list of the medicines, so if your elder is unable to speak for him or herself, the medical staff can administer their care timely and knowing what medication and health challenges your senior has based on a printed list. Ask questions if the senior is not getting the expected benefit from the prescribed medication or having what you think might be an adverse reaction. Be sure to ask any medication-related questions to ensure that both the elder and the caregiver understand the purpose of medications. The Centers for Disease Control also notes that medication errors and adverse drug reactions are likely to increase based on the fact that there's a growing aging population, more medications are being developed, and even new uses that are being discovered for older medicines. Medications can be a very complex issue for seniors and family members to dispense and monitor. If you need help, our customized Elder Compass navigation plan can provide the best medication management strategies that work for your elder and your family. So visit us at eldercompass.net, and thanks for joining us today.